Assalamu alaikum, everybody. My name is Kumail Versi. I'm a pediatric doctor and I am helping to host this event. I'm part of the Salam Centre. It's an amazing opportunity to be here today with a collaboration of different Muslim centres in the local area. We're fortunate to have the Sri Lankan Muslim Cultural Centre. We've got Hujjat Stanmore. We've got Harrow Central Mosque and the British Islamic Medical Association. And it's a pleasure to be hosting this event today on diabetes in Ramadan. As I'm sure you know, this is quite an important topic, especially as it's currently Ramadan. There's a lot of information that hopefully we'll be sharing and gaining today. And I'm hoping that we'll have some chance to also have some question and answers so that those of you who have any questions that are not answered in the talks can be addressed later on. So what I hope to have in terms of this session today is to have a couple of talks, maybe about 25 minutes each, followed by some time for question and answers, and we can take it from there. So we are very fortunate to have Dr. Mathi Woodhouse from who's a GP associate with a special interest in diabetes, and we have Chetali Agarwal, who's a consultant dietitian and nutritionist, who will also be sharing his thoughts. I think that Chetali is here, but I'm not sure if I can't see Mathi yet, and don't know if okay, so Chetali, if it's okay, can we start with you?
Hi everyone, can you see me? Hi everyone, my name is Chetali. Can you see me? Can you hear me?
We can't hear you at the moment, but let me just introduce you anyway. Fine, so Chetali is a HCPC registered dietitian and a full member of the British Dietetic Association, who has 12 years of experience in dietetics. She has a specialist interest in weight management and gastroenterological issues. She provides dietary advice for various clinical conditions such as diabetes, heart diseases, irritable bowel syndrome, and weight management. And she's developed to deliver jointly weight management programs for adults, adolescents, and their families. And these programs are currently running throughout the Central London Community Healthcare Trust. Please can we welcome her and hopefully unmute enough so that we can all hear.
Hi, can everyone hear me?
I still can't hear you.
Can you hear me now by any chance?
Yeah, I hear you. Okay, that's fine.
Can you hear me?
Yeah, we can hear you.
Great, great, great. And okay, but I cannot see me. It's been ages that I have used Zoom, so just give me a second. I have got my slides ready, so without any, just a second. I'm gonna, I can see me now. Good, 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 good. It's all right. So everyone can hear me, everyone can see me, and thank you for my introduction. So my name is Chetali, and I am a specialist diabetes dietitian. Currently, I am working in Harrow Diabetes Centre. We are a Harrow Diabetes service at Central London Community Healthcare, and it's an honor to talk about diabetes with the group of people who are fasting. So firstly, I hope you all are doing okay. And it's a big thing. I believe in religion strongly, so I know it's difficult to fast. So what we are going to talk about is we would like you all to hopefully be healthy and be safe while you are fasting and have got diabetes. The talk that I am doing is more about the people who have got diabetes rather than people who have not got diabetes. So it's still okay it's still okay for people to follow the diet, even though if there is people to follow the diet, even though if there is um, healthy eating advice embedded in it as well. I can see Dr. Mathi Woodhouse joined as well. I think it will be good for Dr. Mathi to talk first, and then it would be nice for me to talk later so that it can then follow nicely. First about diabetes and then talking about the diet, and that would be great. Okay. And just the last thing, I have got Rashida. She is also diabetes specialist nurse from Central London Community Healthcare. She is the Harrow Diabetes. She is part of the Harrow Diabetes Service. And me and Rashida can speak Urdu and Punjabi. So if there is any questions at the end of any of our sessions, if you would like something for us to talk about in any other language, we will try to help as much as possible. So thank you. I will let Dr. Mathi take over from here. Thank you.
Great, thank you very much, Dr. Mathi. Nice to see you today. If it's okay, then, so we can start with yourself. You're mute at the moment, but.
Oh,
okay,
hi. Yep, sorry, I couldn't unmute myself for a minute. Hi there. So yes, I'm Dr. Woodhouse. I'm a GP in Harrow, and I'm also supporting the community diabetes team as a GP with a special interest in diabetes, and have been quite involved with, commissioning and service development for diabetes across Northwest London for the last few years. Is someone sharing my slides, or shall I share my slides?
If you could, that would be amazing.
I can share mine. Okay, perfect. Sorry about this. 1 second. Oh, it says the host has disabled participant sharing. I don't know if somebody can help with that. But while we're doing that, I mean, just briefly, if you could let me know when I can share, that would be quite helpful. So yeah, I mean, so I know Ramadan can vary in terms of the fasting window from where you are geographically in the world. So you can have periods of fasting for a short number of hours, or actually over 18 hours in some parts of the world, depending on, sorry, were you going to interrupt?
You should be able to share.
Oh, I should. Okay, great. Thank you. Sorry about this. Gosh, I can't see a single thing now. Can you see my screen, perhaps?
So you can see your screen.
You can see it, brilliant. I can't see it, but you can see it, great. Okay, well, at least you can see it. But can you see the too fast or not too fast section?
Yes, but it's not on presentation mode. So we can see the...
That might be better, yes.
Yeah,
can you see that now?
Yeah? Yeah, that's better.
Perfect. So, yeah, so, I mean, because of that, I mean, people with diabetes, depending on, the complexity of the regime and types of medication they're on, they may already be advised not to fast, particularly those on insulin or certain types of medications that can cause severe hypoglycemia, which is a very low blood sugar. So, of course, in periods of not eating, continuing to take medication, or some medications act for a very long time, your doctor may have advised you historically to not fast because of the risk associated with it, which is, very true. There are lots of issues with that, but it's not to say that those who have diabetes should not fast. It's just the advice, I think, in the essence of what we're trying to talk about today, is to get some decent medical advice to understand the risk for you as an individual. So why people fast and why they don't fast. So I've just already said people with diabetes might have been historically advised not to. Some people, it's a very individual choice based on risk, and I think that we have to respect that. So every individual may have a preference to do that and still take on that risk and be prepared enough, hopefully, for any consequences of that. And then obviously the religious practice and how strongly people feel about fasting in terms of their religious practice is also, I think, a very individual choice. So we have to take all of those into account when giving advice as healthcare professionals. So I just wanted to cover some of the risks associated with fasting and diabetes. And this isn't to say, this sounds very negative, this isn't to say that there are lots of risks, but I think it's really important to understand as a patient what your possible risks are. So actually, some people's blood sugar gets much better during Ramadan because the calorific intake and food quantity can reduce overall. And for a sustained period of time, calorie reduction, carbohydrate reduction can mean that people's blood sugar gets actually better. But in some cases, blood sugar can get very high. So why? How can it go high if you're not eating for periods of time? So I think firstly, if I refer just to hyperglycemia, which is a very high blood sugar, during Ramadan, if you are taking away your medication during the time you're not eating, which sounds very sensible, actually when people break fast, they may be consuming too much food or overindulging, particularly around, the festivities of eating maybe richer foods or more snacks and different types of fried food. It means actually compared to a normal day, people might be consuming more carbohydrate heavy foods, and therefore if their medication has been reduced, or even if they are still maintaining their routine medication, their blood sugars overall will become higher because they're just eating more carbohydrate rich foods. So this could be anything like rice, chapatis, bread-based foods, but also anything fried or with a flour-based coating. All these sorts of snacks and short eats tend to be quite heavy on carbs. In the reverse, hypoglycemia, which is a very low blood sugar, can also happen. And there is a big, serious risk associated to that because, if your blood sugar drops below 4 and even lower than that, you're at risk of complete fainting, passing out. And, it's a medical emergency, actually. So you need to be very careful, as I've already alluded to, with the certain types of medication and what you do with that. So, of course, as clinicians, we want to prevent either one of those things happening because of the risk associated with it. So hypoglycemia, of course, you can die from that. And lots of people during the fasting window, unfortunately, end up being admitted to hospital and be needing intravenous glucose and, lots of treatment. And we really, really want to avoid that. In the reverse, hyperglycemia, very elevated blood sugars, can in the extreme lead on to something like ketoacidosis, which is where your body starts utilizing fat to break down, to provide your body with energy. And the risk of that is your blood becomes very acidic and it starts causing havoc with your metabolism. So that also is a hospital admission. So we want to try preventing people going into hospital when these things are totally preventable. Of course, if your blood sugar becomes very high, you may have already experienced this if this has ever happened to you. You end up losing water, essentially. You end up passing urine more frequently, and you may even vomit. And so as a result of that, your blood volume reduces and your blood pressure can then start to drop. And this also will lead to fainting, dizziness, and so on. And of course, during fasting, dehydration is a big risk. So I'm sure you already know we encourage lots of water intake in your non-fasting period of time, just to keep your blood volume up, but also clear out all the toxins that may have accumulated and help flush out things that don't need to be there. So you want to be trying to drink as much water as you can, particularly when you just before you start your fast, to keep yourself well hydrated during the day. And of course, people taking medications like metformin or sitagliptin, linagliptin, other sorts of medications, you'll be taking in water probably when you start your fast or perhaps when you break your fast, depending on the advice you've been given. And finally, one of the other quite serious risks, but sort of not really recognized risks, is the risk of clots. So I looked at some research, and in Saudi Arabia during Ramadan, there were lots of patients developing blood clots in the backs of their eyes, which is actually a very rare diabetes associated risk, but the risk of these clots increase during fasting. And I suppose that's much worse in hotter countries where fasting period is much longer, firstly, but also the heat of the country means that you're getting much more dehydrated than you would in a cooler climate. So what do you need to think about when you're speaking to your own healthcare professionals about fasting? So you have to base everything on yourself as an individual. It's very difficult to give advice generically in a talk like this. And that's what I realized when I was drafting these slides, that actually each individual person has a totally different set of circumstances. So people don't walk in with just diabetes. Unfortunately, they come with other issues. You could be older. You may have other medical health conditions like high blood pressure, previous heart disease, other sort of blood clotting disorders, all sorts of things. So we need to really understand exactly what that person looks like and then make a decision based on what types of medication they're on. Because bear in mind, some people with diabetes are completely diet controlled, so they have absolutely no medication. And the advice we give them compared to somebody on 4 doses of insulin per day is completely different. Just understanding how to keep your blood sugar levels steady would be the biggest thing when people are fasting, particularly if they're on medication. So certain types of medication for diabetes do not cause your blood sugar to plummet. So when you take the medication, it keeps it nice and steady. So a medication like metformin is actually reasonably safe to use during fasting. However, like I've just said, if you are not keeping yourself well hydrated during the non-fasting window, there are risks associated to even drugs like metformin. Sometimes, more often than not, we might advise patients to change their doses of medication or perhaps when they take it to support and allow fasting to happen. And usually we would advise people to check their blood glucose levels more frequently. And the most important thing would be to know when you should break your fast and just consume fluids and so on. And that would be based on your symptoms. If you hopefully you won't develop them, but if should you develop them, we would definitely give you advice around when you should just have some water or food. So how do you prepare for Ramadan? Well, we're in the middle of Ramadan, aren't we? We're a little bit late, but ideally, and hopefully many of you will have, if you can, seek in advance of the fasting period to consult with a healthcare professional and get some advice exactly on the things I've said. It's useful to know what your blood glucose level is at the moment, because if your blood glucose levels are very high and then you're suddenly fasting, depending on your medication, we might advise you not to do it. Or perhaps if your blood sugar level currently is quite low, we would have to make certain types of adjustments in medication safely to allow you to fast and not drop even lower. It's always helpful for us to understand what other meds you're on, what your current blood pressure is, what your cholesterol is, to help us build a picture to give you safe advice. And yes, I've sort of already repeated this, so I won't go on, which was about understanding that every plan is individualized. So we have to listen and understand what each person has, understand the signs of a very low blood sugar, which would be feeling sweaty, shaky, faint, dizzy, would be signs of hypoglycemia, which is a low blood sugar. And if you have a very high blood sugar, you may start to pass urine more frequently, you might lose weight abnormally, your vision might become a little blurred. And if it's extremely high, you may develop other things like ketoacidosis, which would involve, you may develop severe abdominal pain, vomiting, and feel very, very unwell. So it's just about recognizing these signs and then knowing what you need to do to treat it. So when should you break your fast? So any life-threatening emergency absolutely means you should break your fast. So all the things I've just said about a very high or a very low blood sugar, clots, if you feel chest pain, if you're very short of breath or wheezy, any sort of physical discomfort or abnormality, not just related to diabetes, means that you should seek medical advice and very likely break your fast. So it's really important to understand that nothing is worth, in my opinion, damaging your health for fasting, because there is serious risks associated with that, and we want people to be alive and healthy and safe. Drugs such as insulin, gliclazide, glimepiride, and several others cause very low blood sugars quickly. So if you're on these medications in particular, it's really important that you seek advice before undertaking any kind of fasting. People with type 1 diabetes are dependent on insulin, and so for them they would probably be advised not to fast. However, if they are fasting, you would have to make some very clear changes to your insulin regime to remain safe. Sick days. So this is, should you become unwell with some other problem like an infection, gastroenteritis, so a tummy bug, a urine infection, these can really affect how your blood sugar is regulated, and therefore your body starts behaving with glucose in a way it doesn't normally. So if you develop, say, severe vomiting or diarrhea, a very high fever, you're not able to hold down fluids because of nausea or vomiting, it's important to understand that these whether you're fasting or not, in a regular day, we would also give you very clear advice if you have diabetes to be cautious with your blood sugar and so on. So when people become unwell, their blood sugars usually actually become very elevated even if they're not eating, but sometimes they can become very low because you're unable to hold any food down. So even in your non-fasting period, you cannot eat or drink properly, which is a big problem, and we would probably advise you to break your fast and take medication, drink fluids and so on to help regulate your blood sugar levels and blood volume. So I think it's really important, if you do become ill with something else, that you recognize that these can be impacting your diabetes regulation and control. And yes, if you become ill, as I've just said, for anything really, it's important to seek advice before continuing your fast. So other things just to think about is that when you're fasting and when you're eating, so when you break fast, it's really important generally during this period to keep a really healthy, balanced diet. Try not to overindulge in carbohydrate-rich food. I know it's a period of fasting and feasting, so it's important to be cautious of your regulation over the whole period of time, and understand that if your weight goes up or down, how this impacts your blood sugar. When you start your fast, before you start your fast, it's important to try to have, if you're diabetic and you're taking medication like metformin or other drugs that do not cause low blood sugar but are still for diabetes, try to have something like a complex carbohydrate in the morning, just to keep your blood sugar level steady during your fasting period, and also drink lots and lots of water if you can before you start your fast and before you go to sleep. And physical activity, we would advise people to maintain their physical activity. We don't have to be completely sedentary, but excessive exercise or physical activity, for obvious reasons, depletes your blood sugar levels, but it also dehydrates you. And if you can't replace that fluid, there's a risk for those with diabetes. And of course, know how to adjust your medication. And that's me done. So I will hand over to Chetali, maybe.
Great, thank you very much. That was really informative. We covered lots of aspects about fasting, including fasting and not fasting, risks associated with fasting, hyper and hypoglycemia. We talked a little bit about how it's important to talk about to healthcare professionals about diabetes and how everyone's an individual, and how important it is to make sure that your individual needs are addressed. We also talked about preparing for Ramadan, albeit during Ramadan, but it's important even for the future as well, and how important it is to consult with a healthcare professional, especially with certain conditions, including things like type 1 diabetes. We also talked about important times to make sure you're looking out for in terms of being unwell and needing to break your fast. So thank you. Those are really, really important. Chetali, if that's okay, we'll move on to you now. In terms of questions, if anyone does have any questions, we can certainly go through those at the end. Just raise your hand if you can, or you can put questions in the chat either on Zoom or on YouTube or other streaming services, and we can try and look out for those as well. So Chetali, over to you.
Okay, good. Right, let me share my screen. I have already introduced myself, so okay. Is it coming as a slideshow? Yeah.
It's starting, just a second.
Sorry, is anyone else trying to?
Yeah, so now
is anyone else controlling it? I cannot control my slides, is it?
So at the moment it's on the PowerPoint screen. It's not on the it's not viewing as a full screen. Oh, I don't.
Hi, can you all see it? I didn't know I had lost. I had forgotten Zoom so quickly.
That's okay. Do you want to start trying to share your screen again?
Yeah. So now you all cannot see the screen, is it?
Yeah. Now I can't see any sharing at the moment.
Sorry about this. Can you see it now?
Great. So we can see your PowerPoint slides. It's not on full screen, but that's okay.
I'll go on the slide view. Just give me a second. Just a second. Is it better?
Perfect.
Great. So sorry about this.
No, that's great. Thank you.
Okay, so a lot of it was covered by Dr. Mathi in terms of diabetes and Ramadan and hypoglycemia. I'm trying to talk more about in terms of the actual diet and hopefully give you some more practical advice in terms of the diet that has to be used for Ramadan. As Dr. Woodhouse mentioned as well, that we are right in the middle of the Ramadan. So I know we have missed the boat slightly, but nevertheless, we have still got another 15 days. So hopefully this information will help you all to manage your diabetes better. I have already introduced myself, so I'm going to move on further. This was briefly touched by Dr. Mathi as well in terms of risk stratification, but I wanted to touch a bit more about the risk stratification in terms of the foods and how the foods can affect directly in terms of hyperglycemia, which is a high blood glucose levels, or hypoglycemia, which is a low blood glucose levels. So in terms of when I speak about the risk in terms of different types of food can have different impact. So eating a balanced diet is really important. I know my slides are a bit more busy, but also I'm hoping that these slides are then forwarded further to your friends and family so that they can get more information about it. So what happens is when, especially maybe during the time between the Suhr and Iftari, what there is a long period of gap where there is no eating, and that time there are chances of severe low blood glucose to happen. So not eating enough carbohydrates or a mismatch between medication and carbohydrate intake can cause the low blood glucose, and this can change by talking to your diabetes specialist team well in advance that you would want to follow Ramadan and how you can change your medications. Severe high blood glucose levels are usually seen during after iftari. What happens is when we are particularly more hungry, we could eat more higher sugary foods, and that can increase the blood glucose levels. And again, to help to prevent that, it's really important to eat small amount of meals and to start off with even small amount to when you open the fast. Now, again, another bigger problem is dehydration. And luckily, we are still not into proper summer, because sometimes Ramadan falls right in summer, and that time the dehydration can get worse, or especially in countries where it is really hot. So 15 to 18 hours of fasting and not eating and not drinking can cause severe dehydration. And again, not drinking enough fluid between the iftar and sur can cause a lot of problems, especially with drinking water. So making sure to drink at least 8 to 10 glasses of water distributed evenly between iftar and sur is very important, and limiting the amount of caffeine and salty foods. So again, I wanted to put this into how it is going to affect your diabetes, though I am going to talk more and more about the diet and similar kind of dietetic principles with the Ramadan as well. So when I talk more in details about the food, it's important to understand what are our food groups. So our food groups are divided into 5 categories. That is the carbohydrates, the fruits and vegetables, fats and oils, proteins, and dairy foods. Now, carbohydrates are the foods that gives you energy and can keep your diabetes well managed. The problem with carbohydrates is you just need to eat the right amount of carbohydrate. Eating too less or eating too more can cause the same problems as we discussed about hyperglycemia and hypoglycemia. The fruits and vegetables are our heroes, if you like, because they are giving you vitamins, minerals, variety, color, you name it, and your fruits and vegetables will always give you a lot to put in your plate and look interesting and variety. The fats and oils can be culprits. So we need to make sure that the fats and oils that we use and we eat is usually good quality fats, less of saturated fats, the trans fat, the fried foods, and the protein foods is your again one of your most important food group, because that would give you your protein for your wear and tear, and also will help you to substitute your carbohydrate, to replace your carbohydrate to protein, to give you that satisfaction of eating. The dairy foods is calcium, is very important. And also I would say that dairy foods is equally good, because sometimes it can give you a lot of fluids, because people like to drink tea, coffee, milk, and that can also give you your fluid intake. So let's talk about, I don't want to go into details about the types of fasting and what other fasting, etc. For the essence of time, I just wanted to pick up more about what could be the problems and how we can resolve it. During Ramadan, we all appreciate that the food pattern is not same. It's not our day-to-day pattern. It's not our day-to-day eating habits. Things change. Things change for a whole 1 month, and we do appreciate. But what are the common unhealthy habits that can occur and how we can resolve it? So eating significant amount of highly processed carbohydrates. We do know that we have iftari parties, and sometimes we would eat a lot of naans and breads. And in our day-to-day life, in our day-to-day eating habit, we try not to eat that, and we try to stick to more wholemeal carbohydrates. Eating desserts loaded with sugar after iftar. Again, that is the time that people get together, they eat together, and usually tend to eat desserts. That is very high in sugar, and that can increase the blood glucose level straight away. Having large and frequent snacks between the two main meals. Now, these snacks can be high in salt and they can be high processed carbohydrates as well, such as samosas, bhajias, pakoras. These are very common as well, and it's important to avoid. Now, one interesting one, eating at a fast speed. So when we are hungry and thirsty, and when we open our fast, what we like to do, eat fast. And when you eat fast, studies have shown your brain does not get enough satisfaction to say that, yes, your stomach is full. So we keep eating, and you keep feeling, oh, I need to eat more, I need to drink more. So try to lower your speed, because this can cause weight issues, and it can spike your blood glucose levels straight away by eating extremely fast. Some days we tend to forget to get up early to pray. We do, but sometimes eating suhoor early, it can cause hypo. If we try to eat as late as possible, it will help for better glucose management between suhoor and iftar. Consumption of large portions of high glycemic index. So the high glycemic index are the foods that will increase your blood glucose levels quickly as soon as it goes into your stomach. You need to make sure that you try to still accommodate a lot of high fiber foods, so that it can help to slow down the process of breaking down your glucose, and that can help as well to manage your diabetes. Eating fried foods too frequently, which can be unhealthy, can change the cholesterol levels, can change your lipid profile, can affect the heart as well. Again, some studies in the past had shown that sometimes between the Ramadan time, we tend to see a increase in cholesterol, and that can happen simply because of the trans fatty acids and saturated fats that can come from fried foods. Now, again, an interesting one is change in physical activity and sleeping pattern. So again, strong studies, strong results have shown that when we tend to sleep less, our metabolism changes, and that contributes to weight gain. And we have seen during Ramadan, it is the time to pray, and it is the time that people tend to change their sleeping pattern, tend to change the physical activity, and that can contribute to weight gain. So these are the common habits unhealthy habits that can be picked up during Ramadan, but we can help to make sure that it doesn't happen. Now, this is a good plate model. If you remember from the balanced diet, generally when we talk about it, what is important is, now think about your suhoor. When you wake up in the morning, use that as thinking as you are eating your breakfast, or you are eating a nice, healthy, balanced meal. So this gives you an exact sort of a plate that it should look like. It can be 1/4 of your plate should be carbohydrates. So coming from your oats porridge, your cereals, or a high greenery bread toast, and some protein. It can be some 2 boiled eggs and some beans or lentil soup, or beans salad, and again some vegetables. A small slice of fruit, and please do remember, a small slice of fruit or a small portion of fruit you can eat, but being heavy on fruits as well can increase the blood glucose levels. But eating small fruits and spreading it throughout the day is absolutely fine for diabetes. 2 glasses of water. Please do not forget to have that 2 glasses of water to keep yourself hydrated between the suhoor and iftari, and that will help you to keep your diabetes well managed. Again, as I said, that you can speak to your nurse, to your GP, to your diabetes team about how you can help yourself in terms of medication and how it can affect your diabetes and hypoglycemia. So again, what type of foods should be avoided? Sugary foods, jams, honey, halwa, sweets, cakes, biscuits, salty foods, and that is very important because that can cause dehydration very quickly and lethargy. And popcorn, unsalted nuts, some homemade biscuits can be eaten, and these are a better option, snack option that you can have. So again, during iftar is you can have the same type of the plate that we have seen. Now, I would like to say few things about the iftar. I have seen over the years what has happened is we used to have Eid celebration, but now in a modern world, a lot of times we have iftari parties that we go for, and it is then very difficult to not overindulge. But again, as I said, your suhoor can be more like your breakfast, and then your iftar can be more of your main meal. But again, think about the time when you have your day-to-day diet. You don't want to overindulge every single day, so you need to still be very careful to avoid all of the fried and sugary foods. Now, dates and milk is something I know that you all use for opening the fast. And why dates? Now, there is science behind it as well. 1 or 2 dates is good to open the fast as well, because your blood glucose levels at this time may be quite low. And dates will help to increase the blood glucose levels at a good speed. But what would happen? We know that dates can increase the blood glucose levels. So if you are eating more than 2 or 3 small dates, and if you are eating throughout the evening dates, then that can increase the blood glucose levels as well, because it is high in sugar. But if you have 1 or 2 dates, it will help to increase your blood glucose levels straight that your body wants, and then slowly help to manage your diabetes. Milk again will give a small glass of milk again, which is good to open your fast, will give you a good hydration and will give you that slow release of glucose, and that will help you to manage your diabetes. The other foods that you can tend to eat is the soups, the salads, and the fluids, and that can help you to feel full and to feel that you have eaten a good amount of food during your fasting. But please make sure your plate should still look the same. Quarter of a portion of carbohydrates, quarter of a portion of protein, quarter of a portion of your vegetables and beans and pulses, and that is how your plate should look. Water and a small fruit. And again, at that time, you can have dates. That is your part of your fruit. So you can have fruit again in the later, after 2-3 hours after iftari, and that gives you a chance to have a snack as a fruit as well. So what food should be avoided at iftari? Again, iftar, opening your fast, fried foods. Again, I have already mentioned about samosas, pakoras, fried foods, pies. These please need to be avoided on your day-to-day. Let's keep that for our Eid celebration, to have a small portion during the Eid celebration, but not in our day-to-day Ramadan fasting. Nice lentils, soups, those are really nice and nutrient packed, and it also will help your body to replenish all the nutrients from a long day fasting, and will help you to keep hydrated. Again, again, we have seen that there could be a lot of sugary foods and things like baklava, the kunafa cakes, and these need to be avoided as well. You can have a fruit instead, and we can use this for the Eid celebration in small quantity at that time. But it is important in our day-to-day Ramadan time to avoid sugary foods as well. Salt, I have been talking about salt continuously throughout the talk, is because the salt is the one that can cause dehydration, and dehydration is one of the common risks during Ramadan. And salt not only can increase the blood pressure and can affect your blood pressure levels, but again, dehydration as an acute risk can be a problem as well. And if you eat a salty foods for a longer period of time during 1 month, then that can affect your blood pressure overall as well. So in summary, I wanted to talk about how we can help each other to keep our diabetes well managed during Ramadan and still pray, still observe the fasting, and be healthy. Very important, be healthy. So divide an adequate amount of calories between suhoor, iftar, and if necessary, 1 or 2 snacks. Meals should be 45 to 50% of carbohydrate overall throughout the day. So as I explained, quarter plate for suhoor, quarter plate for your iftar, and 1 or 2 snacks in between, and that would be beautifully balanced between your period of fasting. Design meals using the Ramadan plate that I have already discussed with you. Sugary, heavy desserts should be avoided, please. High fiber carbohydrates as much as possible. High fiber foods, high whole meal breads, and a lot of granary bread, or a lot of you can add vegetables and make the vegetables parathas instead of having naans and instead of having white breads. Keep hydrated. Make sure that you are having 8 to 10 glasses of water between your suhoor and iftar, and please make sure that only non-sweetened beverages, no fizzy drinks. Please avoid any fizzy drinks. They can only be diet drinks, artificial sweetener added drinks, but not any sugary drinks, please. Take suhoor as late as possible. As I have already discussed that why is it important. It will beautifully help in avoiding hypoglycemia. As late as possible you would take, and ensure that enough protein and fat is eaten as well to make you full. So having a small carbohydrate, but also making sure you have protein. So as I said, that it's a nice 2 boiled eggs or an egg omelette, etc., with lots of vegetables added that can help, and that will make you keep you full. And as soon as you break the fast, you have the iftar, drink lots of water, less of dates, just 1 or 2 dates, to avoid raising too much of a blood glucose. But we do need that little to start off with our blood glucose. And also low calorie snacks such as fruit, nuts, or vegetables in between your meals. Okay, so I would like to say a big thank you to My Way Digital Health and Aldar. This is a very, very good website, and they have loads and loads of information. If anybody would like to go on the website and learn more about Ramadan and fasting, this information has been taken from this website, and I would like to thank you to both of them as well for this. Just a last thing, I would like to say this, and this is my philosophy, is more about, can I now come out of it? Have I come out of it?
So we can still see your PowerPoint screen. But if you
can you stop
stop
sharing for me, please? Okay, great. So my philosophy on this is, it's usually, let's take our suhoor as a breakfast, And then if we say more about taking our lunch or our evening meal as our iftar, and the whole snacks in between that, and that gives us nicely a whole day pattern to just literally swap your day, and that usually helps with the diabetes management. So thank you, and I hope this was helpful, and well done everyone who is fasting. It is difficult and it's not easy. Thank you.
Great, thank you very much. Lots of information there. Thank you. We talked a little bit about risk stratification, what the issues are, how they come about, and how they can be mitigated. We talked about different food groups, so particularly looking at what can be beneficial and what can have can create problems. We talked about some healthy and unhealthy habits, including unhealthy habits like eating large meals at iftar, eating lots of carbohydrates, sugar-laden foods. And sleeping less as well. And we also talked a little bit about what type of foods to avoid. And as Chetali said, we've got a nice idea of having sahur as your sort of breakfast and your iftar being as your main meal. So there are quite a few questions coming through, so hopefully you can start going through them. You might also have seen on the chat that we have Lucy, who's kindly put forward quite a few different websites as well, which can be very helpful. Please do feel free to have a look through them. And again, if you have any questions, we've hopefully got about 15 minutes or so where we can go through those. And if you have questions, yes, please feel free to raise your hands. I can see Jibs has raised their hand, but we will first just go through some of the questions which are on the chat. I can see that some people are also replying on there as well, which is great. Shall we just, Dr. Woodhouse, is it okay if we go through the gestational diabetes question? Because it looks like there's a bit of information come through about what exactly they want to know. So they've just asked what recommendations would be for fasting with gestational diabetes. The blood sugar limits recommended to us as pregnant ladies are very different to type 2 diabetes. So just wondering about different advice, if that's okay.
Perfect. Yeah. So yes, it's a very individualized answer I have to give there. So with gestational diabetes, I think first of all, it would be useful. We have to risk assess the individual really. We need to factor in how many days of the fasting window is included in that pregnancy, how many understanding which trimester the lady is in would be useful. So the advice given to someone in their first 12 weeks of pregnancy versus the latter 12 weeks of pregnancy will impact the advice given. Unfortunately, it's not very easy to give a clear answer basically, but I mean, also it depends on how that person's blood glucose is being managed. So for example, if you have a gestational diabetes and you have been advised to just control your diet only, the thresholds, I think I had asked what specifically, and this was about whoever had asked the question, Sukaina was it, had asked specifically about what blood glucose targets they should be following. Those targets remain the same. There's no leeway given because ultimately here the tight control is to limit any risk of complications to the baby and fetal development. So if you are diet controlled and pregnant and you're in your first trimester or your last trimester, it doesn't matter. Those glycemic control targets remain the same. If somebody is, say, on insulin because of their gestational diabetes, you would probably be advised not to fast because it's just far too high risk, and the risk of high blood sugars or low blood sugars to the mother, one will be variable, and actually whilst pregnant, the way your body manages blood sugar and the regulation and development of glucose is much greater, and the demands on your body when pregnant are very different, so your body behaves in a very different way. So unfortunately, it would be surprising, but I would believe that most women would be advised not to fast when pregnant and on insulin.
Thank you. And just out of interest, what are your thoughts generally about fasting in pregnancy? So, are there? I mean, I'm guessing there are some people who'd say that actually fasting during pregnancy itself should be avoided generally. I mean, is that something which has any truth behind it?
I know. I did. I know. We technically, I think the general kind of view is that we should not be encouraging women to fast when pregnant. However, if you are, as Chetali was saying, consuming enough fluids and adequate types of complex carbohydrates in a good diet during your, non-fasting period, technically, I don't see why that could, is a big issue. It's a very individual decision. But one of the main risks of being pregnant, particularly heavily pregnant, is your metabolism is operating much harder. So the energy requirements are, a little bit greater, particularly fluid intake. I think that's where, there could be an issue. And if women are sort of adequately consuming fluids in the periods they can, then you would imagine that there would be less risk. When they have looked at studies and so on in women, particularly with diabetes, fasting, actually there was no increased risk of fetal hypoglycemia or hypoglycemia actually in the children when born, but there was an increased risk of jaundice. So that would be expected because of the dehydration levels and the increased glycogen breakdown. So, there is risk associated with it. But I mean, if you're a woman and you're otherwise healthy and fine, and you would like to undertake fasting, I think, just as I've said, if you consume enough fluids and correct types of food, I don't really see the risk associated with that.
Thank you very much. I think if we're okay, Jibs, maybe you can ask your question.
Yeah, Assalamu alaikum. Thank you. So one of my questions is, just to give you a very brief background, I am diabetic type 1, have been for probably 11 years. Before I didn't fast, but especially in the COVID time, I decided to fast because obviously I'm at home, I'm not going out and about, and there's always a risk of going low during fasting. So just a two question, and I think one of the questions has been kind of covered. During obviously fasting, and I'm on a normal blood glucose level, I've noticed I've had increases of blood sugar, especially during fasting. And I don't understand why, especially when I've not consumed anything. And if I'm at the level of, let's say I started at 7, it goes up to 10, 11 as well, which I find a bit weird. And I know Islamically you can take insulin while you're fasting, but the risk of doing that, you could easily go really low. And it's very hard to balance that as well. So sometimes I stay kind of high on that for that reason, to avoid going super low. So the other question side to this, if I do go low and to avoid breaking my fast, is there, I believe you can get glucose injections as well. And if that's something suitable to avoid breaking the fast, because a lot of people don't break their fast because it's kind of classed as, again, I need to clarify this because I'm not sure. It's like, it's kind of really bad if you break your fast, but obviously for a medical reason, I kind of get it, you have to do it, but it's kind of more sinful in a way to break your fast. Again, I'm not 100% sure on that particular topic, but it's something I will find out. But I know a lot of people try to avoid breaking their fast for that reason. If that's something you can help me out with, I appreciate it.
Thanks. Mathi, is it okay for you?
I can attempt to try to answer a couple of the questions in there. So one of your questions was, why is my blood sugar high when I'm not eating? So for those, just to clarify, people with type 1 diabetes need insulin every day. They need to top up insulin before eating to help regulate the blood sugar. And usually, I know, Jibs, you're probably having a basal insulin, so a long-acting background insulin as well. So this is where speaking to a clinician before you start fasting is really important, because if your sugar control from the beginning is not great or it's very good, it will really impact how we advise you with your blood sugar. So if your morning glucose levels are still, is it that your morning glucose levels are high, or during the day it's high? That's what I couldn't quite grasp. But if your morning sugars are elevated.
Sorry, yeah. So in the morning, so before suhoor, I make sure my blood sugars are fine and obviously calculated. Obviously when I have my breakfast.
Yeah.
So like today it was like 7, which I was happy with. But let's say today later on, I know around let's say 10, 11 o'clock or even 12 o'clock, it will go high. And I'm not sure why.
So as your body, you know, as you probably know anyway, as your body is, you know, during the day, stress, movement, you know, your metabolism will fluctuate. And so your blood sugar can go up simply through stress or movement, or if you're exercising and so on, it will impact that. Also, if you're sort of having a bolus of Nova Rapid or fast acting insulin with your early morning meal, but your background insulin is sort of hanging around there as well, but reducing, it could mean that during the day, your sugars, even though you're not eating, is rising because the Nova Rapid is not quite working anymore and it's just creeping up again, potentially. The other part of it, the question was around, you know, can you have intravenous, I'm assuming glucose, to correct a low blood sugar? Or an injection of some form. I mean, we would strongly advise against that because hypoglycemia is a medical emergency and needs rapid correction. And the only way you can do that is by orally consuming something, as you probably are fully aware as somebody with type 1 diabetes. So, you know, having some jelly babies or a sugary drink or anything you can get your hands on at that point in time to quickly correct that glucose level. So by the time you call an ambulance or someone takes you to hospital and you queue up in A&E to get something, it'll be far too late. So I would really strongly advise against that. And one of the things I mentioned in the talk was around severe hypoglycemia and the need at that being one of the grounds to break your fast immediately.
Thank you. And I think it will be universally agreed that if you have a medical emergency or anything, of course, you are allowed to and encouraged to break your fast in order to preserve your health. There are a couple more questions, if that's okay. Chetali, is it okay if we, I think some might be directed towards you. So one of them was about the talk that you mentioned, water intake of 8 to 10 glasses of water should be spread out evenly between iftar at 8 p.m. and zuhur at 4 a.m. Could you recommend how this is achieved while we also try to incorporate 4 to 6 hours of sleep?
I saw that question and I almost smiled because, you know, if you are drinking very close to sleeping, then you would have to get up to urinate as well. So when I say 8 to 10, this also includes the teas, coffees, soups, and other watery fluids and watery foods, if you like. And that's why I emphasized on the fact that, you know, soups are good, lentil soups or dals, and also milk is good. So that would also be part of your 8 to 10 glasses. So say if you had two during the iftar and then two say just 2-3 hours before sleeping and 2 in the morning, and that would be your 6 glasses, and the other two can come from your tea, coffees, and a glass of milk when you open the fast. So 8 to 10 is, the 10 could be the maximum, but 8 is a good number. So if you have 6 glasses of water during the iftar and suhoor, and then 2 could be coming from the food as well. So 2 definitely between the iftar and the first 2 hours of opening the fast, and then the 2 in the morning for sure before we start fasting. So that would be a 4 and 2 in between.
Thanks. And again, to probably direct to you, do you recommend using protein shakes to meet your protein requirements?
So again, protein shakes are okay to have. So if in the morning, if someone would like to have a protein shake in the morning for suhoor, is fine. As I say this very, very carefully, that this talk that we are doing is for general population with diabetes and Ramadan. We are not giving any individual advice. We do not know if someone's kidney functioning as well, etc. Okay, so this is more about the balanced diet that one can use during Ramadan and for fasting and diabetes. So if everything is good, if everything is fine, if the kidney functioning is good, having a protein shake is absolutely okay. We need to be careful. The protein shakes can be high in sugar as well. So you have to read the labels and be extremely sure, because protein shakes can be sometimes quite horrible in taste. I don't know if you have tasted, they can taste quite metallic and quite horrible. So if it is not high in sugar, because sugar is added more for the taste purpose, so if it is not high in sugar, then it's absolutely fine to take protein shake. Any other questions from any of you?
Sure. So there are a few other questions. Just going back to the type 1 diabetes question, I think Rashida wanted to I'm just trying to find
she will have to be unmuted, because I think Rashida is muted.
Oh, there you are, sorry. Yeah, there you are. It's because you have one of the few who has your video.
No, I thought let me chip in, Dr. Mathi, and because as Chetali mentioned earlier, we work together, all of us, actually, 3 of us. And no, it's well all covered, but going back to the pregnancy, because if somebody before Ramadan have your HbA1c done and your kidney function, and then that will give the target what you really do in pregnancy, whether you should be fasting or you should leave the fast out, because metformin you go to take it anyway if you are on, and insulin if you are just long acting insulin, so that will be the another. And then I would like to say to everybody, thank you so much. It's a lot of the participants are there. Please, before Ramadan, that's they have your HbA1c, the blood test, and for your kidney function as well, and ask your doctor or ask your specialist nurses to please review your medication, because there are medications, some of them Dr. Mathi has already, but because this is my job day in, day out. So there are some medication which you need a lot of water, SGLT2, and if some of them you don't need it. So if you have a like individualization, have everything beforehand, it will help you during your Ramadan to make your own choice as well. So that's what I would like to say to. And please, if there is anybody struggling with the English language, Chetali and myself, we do speak Urdu, Punjabi, and Hindi. And Punjabi is my mother tongue. So please feel free, because we are multicultural. Thank you so much. And any question, please do ask us. And because that's why we're here for.
Amazing, thank you very much. And I think Gus has also posted in the chat some information from the the British Institute of Medical Institute compendium, which talks about pregnancy and talks about the different risks in different sort of situations in pregnancy, I guess. There have been some other questions, but actually I think some have already been replied. So one was about air-fried samosas. Are they okay to eat? I don't know about that, if that's just generally or during fasting. That's another question entirely. But I think the answer was about that it's a good idea, but do remember that it's also carbohydrate because of the pastry. Yeah, sorry.
I have just replied that, it is air frying is amazing. It's a very good idea to do the air frying, but please do remember it's more about the pastry, and the samosa is maida, is simple carbohydrate, and that is the thing that we want to make sure that it is not used. So you can try to avoid it, but then it's better to have some other onion and spinach pakoras, which can be air fried as well, and you can have that 1 or 2 as part of your treat. But again, they are so high in salt, so there is no win-win situation here. You use air frying to avoid the oil, and then you see the salt coming in, and then you avoid the samosa and go into pakoras. But so it's just important balancing out. Always remember, how frequently are you eating the food that is high in salt and sugar and fat? I always say the frequency is most important. If you are having it as a treat in the smallest quantity and just once in a week and the small quantity, just enjoy that small little portion. Then at least your tongue is satisfied. This is all about your tongue. In the body, nothing happens. It's all about that little tongue and you feel happy. That's it. Happy days. Small portion.
Great, thank you. And I can see there's also a question about semaglutide, which has been answered, hopefully. Asada, you asked a couple of questions. Do you want to ask anything which we haven't covered? Just raise your hand if you do want to. We're coming towards the end, if that's okay. But any final questions? James has another question. Just maybe take it quickly, if that's okay.
Yeah, it's just a very quick question. Future-wise for diabetes, I mean, what is a new diabetes medication? For example, I've heard that there's insulin that you could take, like once a week insulin that I've heard and rumored about, and I just want to know if the doctor's aware of any new treatment available or new research done around diabetes. And I also heard there's some study going in America that you can take insulin once every 3 years as well. And I don't know if that's true or not, if you've ever come across that, because that'd be amazing. But yeah, that's about it from me.
I do not know about once every 3 year insulin, which would be amazing if that was true. I struggle to believe that that's possible at the moment, but anything's possible. So as far as we know, no. I mean, in terms for type 1 diabetes, there aren't, there are always newer, like faster acting. Say, for example, there is a new well, it's not that new, but there's a slightly better, faster acting, rapid acting insulin, so replacing things like Nova Rapid and Humalog, which works a little bit faster, so you don't need to take it 10 or 15 minutes before you eat. You can take it right with eating, but these all need to go through like approval and licensing to get approved on the NHS. But using something, was it once a week, did you say? I don't know anything about that, unless Rashida or anyone else knows. I'm not really aware. But what we do know is like the monitoring for diabetes is getting much more trendy. So you can have much better, now glucose regulation can be improved because we can track things in real time and pumps are getting better and things like that. So these are things for type 1 diabetes as well. But as far as more about new insulins, I don't know anything yet. I don't know, Rashida, if you do, or anyone else here. Oh, she's muted.
And then someone's put in transdermal insulin.
Yeah.
Still unmuted.
Thank you. Thank you for your answer. That's because, as Dr. Mathi has already said, with the type 1 diabetes, as we all know, the pancreas has failed, is not producing. But yes, I agree with your one question. There is on pipeline something, but we don't know at the moment. I have heard it's a weekly injection, but we don't know at the moment. But we don't know. But for type 1, you have to have insulin to survive. That's all we know. And I hope we have answered your question and not disappointed you.
Thank you very much.
Thank you so much.
In terms of the slides, if you do send them across to us, then we should be able to share them with the rest of our communities. And again, there are lots of links which have been mentioned on the chat, which we can also share with our communities. They all look extremely helpful. So if you have any further questions, then you should be able to hopefully get through to your local practitioner who might be able to help you, and healthcare professional. Thank you very, very much to all of you for joining, both participants and speakers. We're very, very fortunate to have had Chetali and Mathi here today, and Rashida as well. And hopefully we will be able to hold something similar in the future, maybe exploring other aspects or helping others who haven't been able to join us today. A lot of this talk itself will be online on various for various communities, and hopefully they'll be able to therefore access that as well.
Can I say, sorry, I just noticed Telicity. Please don't make mistake Telicity with the type 1. Telicity is for type 2. So don't make you be ill. So just type 2, Telicity, no for type 1. Because I saw the question there. That's why I thought just say it openly. But thank you so much. That's brilliant, actually. Very good education.
Thank you once again for inviting us. It has been absolutely an honor and pleasure to talk to and having such a good outcome in terms of all the 4 mosques were here, and UC's hard work and the Salam Center's hard work to get this to roll in with such a short period. So thank you. And we would be more than happy as a Harrow Diabetes Service to help in future, to help to educate in terms of anything with diabetes. So thank you once again.
Thank you. I think that we can bring this to a close. I don't know if there's any interest in having some information about some of the communities which have joined us today. I think there's, like I said, there's some participants from both, from the Salam Centre, from Hujjat, from Sri Lankan Muslim Cultural Centre, and from Harrow Mosque. Asad, shall we start with you? Did you want to, shall I allow you to share, do you want to show the video about upcoming progress in the Hujjat Hairfield site? Perhaps I can. Are you still there? Okay, otherwise I can maybe try to share the link which you sent. Just 1 second.
A few months ago.
Let's try to.
A few months ago, we completed our purchase of Hujjat Hairfield, a milestone in Hujjat's 50-year history. This was only possible because all of us as a community stood up and supported the creation of a new community centre. It is your involvement that will shape and guide each step we take in this momentous journey. Through the many focus groups and engaging conversations we've had so far, the vision of Hujjat Hairfield is taking shape. One of the areas you, as a community, have asked for is a clear understanding of the financial position of the project, which is what we would like to present today.
We purchased the property for a price of £33.5 million, including professional and finance fees. To date, the community has generously donated a total of £7.9 million. We have received a contribution of £8 million from the World Federation. Total Qaza Hasana received was £5.9 million, and of this £3.5 million remains, which will be repaid on their due dates. The balance is by way of a commercial interest-only mortgage from the co-op of £14.1 million, which is secured by the Hairfield site, with the principal amount being repayable in 3 years. Our focus is now on the repayment of the £14.1 million loan, and we are confident that together as a community, we can do this. We can only achieve this if all of us work together and all of us give as much as we can.
Repaying this loan is vital for our future. We have 2 ways of doing this. As you know, last year, we were granted an ijaza via the World Federation to collect up to 14 million from Qum's donations. Therefore, if you donate your Qums via Hujjat, not only will you fulfill your annual obligation, but also participate in Sadaqah Jariyah for our community center. Secondly, we would urge everyone to participate in our Hujjat Legacy Direct Debit campaign. The Hujjat Legacy Direct Debit campaign gives an opportunity to each and every household and businesses within our community to donate a manageable monthly amount that will allow us to collectively meet our goal. We have 2,500 families in the community. This works out an average donation of £150 per month per household. This commitment from household and business would allow our community to be debt-free. Every penny counts. So please give what you can. Some will be able to give a little less and others a lot more. But together we can make this happen. Our sacrifice will ensure our children and grandchildren continue to be guided by the message of the Quran and the Ahlul Bayt alayhimus salam.
And it's okay, we'll just show one about the Salam Centre as well. Just a second.
You're really meeting such a wide section of society, and everyone there is so incredibly welcoming.
And women have equal opportunity to ask questions.
We're working as faith communities with our own identities and different identities.
They are open-minded. They celebrate the joy that other faiths have.
Somewhere where you can excel spiritually, but also somewhere that can empower you mentally and intellectually.
A space that is being curated for Muslim communities and by Muslim communities, but for the wider society.
It will be somewhere that, again, people of all ages can come together and learn.
I'm really excited about the Salam Centre. I think it'll be a beacon for the rest of the world, not simply for the community in Harrow, not just for the community in London, but for the communities all around the country and the world. It's an example of the Muslim community not only looking after their own, but looking after and offering things to others as well. A 22nd century building in the 21st century in the heart of London. What else could we ask for?
The joy that will emanate will hopefully last beyond my lifetime to my children and hopefully their children.
Great, so hopefully that gives a little bit of information from a couple of their centres. I'm not sure if there's anyone from the Lankan Muslim Culture Centre or Harrow Mosque who'd like to share a few words as well. We'll share a video. Otherwise, I think we will end there, if that's okay. Thank you again for joining today. And again, if you have any questions, please feel free to speak to your local practitioner or get in touch with the organisers, and we can help to put you in touch if necessary. And thanks, Mathi, for answering further questions on the chat, and Chetali as well as we've continued. I don't know if you want me to leave it open, but I think we should stop for the next couple of minutes at least. I think if what I might do is I might just leave it open for others who want to maybe talk between themselves as well for a few minutes before we go. I'll just see if I can get everyone to unmute. and then you can and then anyone who wants to ask, I mean, there's no particular requirement to stay if they want to, but just I know that there's opportunity that people might want to speak between themselves, because everyone has different opinions and different experiences, so please feel free to talk between yourselves as well, and we can chip in if we can help at all. Maybe there's not so much interest. That's fine.
Hi, sorry, I've just been asked one question. How do you manage taking dates, obviously, while you're fasting as a diabetic? I think there's just some concerns that, dates aren't normally consumed throughout the year, and then suddenly during Ramadan, you pretty much take 1 or 2 a day. So I've just been asked that question right now.
So I can help to answer that question. So dates are high in sugar. Dried fruits are usually concentrated sugar, so it is better to avoid. But I do know during Ramadan, it's a good idea to fast. And also I think religiously, it's good to open your fast with date. So you can have 1 or 2 small dates, and that will also help in managing your diabetes. But throughout the year, it's a good idea to please avoid dried fruits. So dates, apricots, raisins to be avoided, but nuts is a good option. So you can have nuts as a snack rather than having dried fruits. So please avoid dried fruits, but nuts is a good option. And just during Ramadan, you can use 1 or 2 to open the fast, should be okay for diabetes as well. Does that answer your question?
Yeah, I think that's very helpful. Thanks.
Fine, I think we'll close it there. And thank you everybody for joining once again. Nice to meet you, Mathi. Nice to meet you, Chetali.
Yeah, thanks. Thank you.
And Roshi as well. Sorry, I keep on missing you out.
Thank you, and Ramadan Mubarak, and then Eid Mubarak as well. Soon,
thank
will soon go.
Yeah, it will. It rushes by.
Exactly. And thank you, and it's a lovely meeting,
It was
everybody.
very nice. Thank you so much.
Thank you.